This conference will now be recorded.
So hey guys, as I roll through the get back to the title screen here, I just want to thank again everybody for coming to tonight's webinar on injury prevention. Um, Super honored to have Karen Shanahan of Athletico Physical Therapy back with us. I want to say that this is probably the fourth year in a row, Karen, that you've really kicked off our summer training season. We have folks or athletes on the call tonight who are training for various fall marathons, in particular the Chicago Marathon, the Berlin Marathon, the New York City Marathon, and others. So we have a nice variety of endurance athletes that are training for various races. So for everybody who's on the call, Karen Shanahan is the facility manager at the Lake in the Hills Athletical Physical Therapy clinic in Lake in the Hills, obviously, which is just right in my neck of the woods, which is in the northwest suburbs of Chicago. For those of you who are not familiar, just a little bit about Karen. She is a doctor of physical therapy, a certified athletic trainer, a certified strength and conditioning coach, and quite an endurance athlete herself. So I feel like she is uniquely qualified to take us through this journey tonight. The unfortunate statistic is that, and I don't know what the current statistics are, and maybe Karen, you can correct me, but upwards of almost 80% of runners get injured on an annual basis. And so we want to figure out ways to not only minimize our risk, but when we do get injured, how do we get back on the road and putting the miles in as short a period of time as possible? So without further ado, I'm going to turn tonight's presentation over to Karen Shanahan of Athletical Physical Therapy. Thanks, Karen.
Thank you, Seth, for that introduction, and thank you everyone for logging on and listening. Um, it sounds like you guys all have some great marathons coming up. Chicago's a near and dear one to my heart. Berlin and New York City are both on my to-do list at some point, so I can't wait to hear about how your experiences go with those. Um, so for to jumpstart marathon training, you kind of got to figure out what you got to do. Obviously, signing up for the race is the easy part. Getting involved with a running group and a running coach is key to help keep you on track and to have that support for going through and getting all these long runs in. And as you're starting to run and run and run, like Seth alluded to, there's a high likelihood that injury can happen. Um, Current stats are probably about that 80% still of runners will have some type of injury. And that can range from something very minor that, just causes you to alter your training for just a day or two into something that can be more significant and sideline you and potentially impact your race day. Those are things that we obviously don't want to have happen. So we want to try and minimize that risk for injury as much as possible. Um, so some big things, some big risk factors for increasing running injuries are abrupt increases in mileage. So if you're going from 0 miles and trying to jump in and run 10 miles right after that, that is obviously going to potentially impact your risk for injury, and not to mention it's going to be pretty hard to do. So we want to have a gradual increase in mileage, thinking about kind of a 10% rule, gradually increasing, kind of no more than 10% as the previous week. And ideally, in most programs, do have kind of an ebb and flow a little bit, where the mileage will increase and then you'll cut back a little bit and then increase again. And that's built in there to design to minimize your injury risk. That's not saying that you couldn't, once you build up to 10 miles, that you couldn't run 10 miles the next week, but sometimes you need to kind of step back, and that's to minimize that injury risk and allow the body some extra recovery time. Another common risk factor for running injuries is having a previous injury or not fully recovering from an injury. So if you are trying to start a new running program or progress your running program to the next level and you haven't fully taken the time needed to complete recovery from a previous injury, that can increase your likelihood of having another injury or re-aggravating that same injury. The less experienced you are with running, the more likelihood there is for an injury as well. And That's similar to most sports. When you haven't done something and you're trying something new, your body isn't accustomed to that motion and those movements, so that can increase your injury risk. And then on the flip side, competitive training can also increase your injury risk. So someone who's trying to go for a BQ, or someone who's trying to, you know, best a friend or a coworker so they can have bragging rights at the office, that can potentially increase risk of running injury as well. Other contributing factors to injuries can be age. Unfortunately, the older that you are, the increased likelihood that you are to have injury. On the flip side, sometimes beginning to do marathon training at a very young age can also increase the risk factor, and that's because the body's skeletally immature and doesn't have that experience level on there. Running shoes, the type of footwear, whether they are too old or whether they're inappropriately fit for you. So if you're someone who has a very flat foot and you're not having a shoe that has support, that could contribute to it. BMI, so a higher weight can increase running injury, and that's because every step that you're taking, every foot strike, it can compound your body weight. So the heavier you are, the more weight and more shock absorption that your body has to take into effect. Gender, females are at an increased likelihood compared to males. On the flip side, I always say that sometimes, males can, if we say stereotypically, can be a little bit more competitive, so that competitive juice can increase their injury risk as well. The terrain in which you're running on. So running on a hard concrete surface can increase the risk of some stress reactions and from that impact. And then on the flip side, if you're doing a lot of trail running, you have an increased likelihood of more things like an ankle sprain due to a fall because of the uneven surfaces. Having a muscular imbalance, being inflexible or having muscle weakness, that can contribute to injury as well. The body just is not at the best possible position to be able to tolerate the demands of running. And we'll talk a little bit more on that in the future. And then nutrition, not having enough calories, enough good balance of, fats, proteins, and carbohydrates, or kind of falling to the wayside of, hey, I just ran 10 miles, so I can eat a pizza and have ice cream and, have that brownie that's looking really good. Just making sure that you're getting adequate calories, but also good nutritional calories. So making sure you're eating a lot of, fruits and vegetables, whole grains, things like that to have a nice balanced diet. So some of the most common running injuries when it comes to marathon training are listed on the screen right now, and we're going to talk about each of those individually. And most of those injuries are more of a chronic or injury, or more of a cumulative effect as opposed to an acute injury that happens from, let's say, a fall on a trail run where you have an ankle sprain. So plantar fasciitis is typically characterized by pain on the bottom of the foot in the arch. Kind of can feel like a dull ache or a bruise. Many times it begins in the heel and kind of radiates up towards the arch, but sometimes it can just be in the arch. It typically tends to be worse those first few steps in the day or after you're sitting for a while and getting up and walking. And many times you have that soreness and pain at the beginning of the run, and it kind of gradually gets better as you're running. But then once you stop, it kind of tightens up again. So many different causes for this, including high arches or a flat foot. So kind of a foot that's not at a more neutral position can change the way in which your foot hits the ground when you're running, and that can increase the amount of stress on that area. Kind of combined with that, shoes that are improperly fit for you. So if you're wearing, like I kind of alluded to earlier, if you have a very flat foot and you're wearing a shoe that does not have support for that arch, that can contribute to it. Like I said, with regards to when the foot hits the ground, that over-under pronation, so allowing your foot to cave in too much or not allowing it to cave in as much as it needs to. Rapidly increasing the mileage too quickly can place additional strain on that plantar fascia. Some strength imbalances, so if your hip flexors are very tight and you have a weakness in your core, you can be relying a little bit more on your lower leg to push off and to advance, and that can increase the stress on the plantar fascia. Or sometimes you can have a leg length discrepancy. And by this, I don't mean that one bone is longer than the other bone, but some of that muscular imbalance, some tightness in one side and weakness in the other, can create almost like an apparent leg length difference where one leg is apparently longer than the other. So what do you do if you have this? Things like an ice massage, making sure you're doing properly fitted shoes, or potentially putting orthotics in your shoes that provide a little bit more of an arch support. Sometimes if it gets bad, you can do like a night splint or something called the Strasbourg sock, which is pretty much a device that puts your foot in more dorsiflexion, so kind of bringing your toes towards you to provide kind of a gentle, long, prolonged stretch in the calf musculature. So doing calf stretches and for both the gastroc and the soleus muscles, so those are the two big muscles in your calf. Doing core strengthening and things such as Graston or ASTEM, so pretty much instrument-assisted soft tissue mobilization. And what that is it uses a different kind of tools in order to get a deeper tissue massage and break up some of those restrictions in those fascial layers. That can really be beneficial, and you'll hear me kind of allude to it as well with some of these other conditions, for these chronic inflammatory conditions. Next up is Achilles tendonitis. Achilles is the part of your the back of your heel where your calf muscles attach into that tendon. Very commonly associated kind of with similar things as plantar fasciitis. You're feeling tightness and pain in that lower calf and the back of the ankle. Sometimes you can get some swelling, and occasionally if it's really bad, you can get something called a Haglund's deformity, which is kind of like a bony prominence on the back of the heel from that Achilles pulling into some calcium building up there. Like I said, very common causes as the plantar fasciitis, that dramatic increasing in training, so increasing the mileage too quickly or running on steep hills or doing a lot of sprint and repeat interval work. Tightness and weakness in the calf muscles is a big contributing cause. And weakness in your hip and core, like I said before with plantar fasciitis, sometimes that weakness causes you to try and push off too hard, and it's not as efficient as it should be. And then, of course, improperly fitted shoes can be a factor as well. So typically, if you start feeling this, you want to do a little bit of rest at the beginning, and it doesn't mean you have to stop running completely if it's caught at the initial stages, but minimizing the impact. So doing something like a stationary bike or elliptical to decrease some of that impact can help. And that kind of ties into that decreasing the running mileage and intensity to really just kind of allow for a little bit of healing. Working on that calf strength. And so with eccentric heel raises, that's working on really the lowering portion of the heel raise. So you can push up and just really concentrate on slowly lowering down throughout that. And people will typically start kind of both legs on the ground, progress to on a bottom of a stair or a stool, so they're allowing their heels to drop even more. You can go up on 2 feet and then go down on one, and then you can progress to single leg as well. Making sure that your shoes have enough shock absorption in there so that they're properly fitted for you. And a lot of times minimalist runners or minimalist running shoes can have an impact. So having a little bit more cushion can sometimes make your running a little more comfortable. Some people also like using compression sleeves or socks to keep that calf muscle warm, to prevent some of that tightness and aching. And then, of course, ice can be a factor that can help decrease some of that inflammation and help with some of that healing. So on the opposite side of the lower leg, there's the shin. Shin splints is kind of the general term. The kind of more official diagnosis would be medial tibial stress syndrome. So pretty much it's described as an aching or soreness along. Typically it's the inside, but it can also be the outside of the shin from the repetitive impact on the ground and some muscle imbalance. So the pain, if you catch it early, typically is at the beginning of the run. It kind of gets a little bit better and increases again afterwards. And you'll notice I kind of say that about various of these tendinitis type of conditions or these chronic inflammatory conditions that, you know, you might have, oh, it hurts too much. I'm going to try this run. Oh, it feels better. I think I'm doing better. I was able to run 5 miles, and then I finished and I was having trouble walking again. Uh, so that can be common. And if you're at that stage, you want to shut it down then, because otherwise you're going to get into a stage in which it hurts at the beginning, during, and at the end of the run. And then it starts getting so it hurts when you're walking around in day-to-day activities. So kind of recognizing these things earlier on will help you to kind of get ahead of the game and manage it earlier. Causes of shin splints can be if you have not been running for a while, so whether you're a new runner or if you have returned to running after a while, wearing old shoes that don't have that support in them, running on harder surfaces, so thinking like concrete or roads even. So if that's the case, running on like a crushed limestone or a dirt path, or sometimes even a treadmill can have a little bit more shock absorption that can help you get in your runs with less pain. Making sure that you have good hip and core strength can also be a good factor to help decrease this risk. And then other training errors, and such as increasing mileage too quickly or attempting to do too much hill or speed work, can also be a contributing factor to the cause of shin splints. In terms of treatment, making sure that you are stretching calf muscles is important, but also it's often forgotten to stretch those muscles at the anterior, that front of that lower leg. Potentially changing shoes if you have old shoe wear or a less supportive shoe. Making sure you're strengthening the hip and leg muscles. I kind of talked about some of these already, running on softer surfaces, and making sure you're slowly increasing that mileage. Rest and ice can also help to decrease this, and sometimes adjusting your running form. If you are overstriding, meaning that your foot is hitting the ground in front of your hip, in front of your knee, that causes an increased braking impulse. So your body has to kind of recruit more muscles to help kind of slow down and get your body, the mass of your body, your trunk over your foot. So kind of shortening your stride a little bit and striking the ground with your foot a little bit more underneath your knee can help to decrease this braking impulse and can help with some of the shin splints. And then also using Graston or ASIM can help with that as well. Moving right on up the leg, patellofemoral pain syndrome, or kind of more commonly known as runner's knee, is pain that's typically described as a dull, deep ache that's underneath the kneecap or kind of right below the knee. And that can become worse with stairs, especially going downstairs or running down hills. And people also will complain of stiffness when they're sitting for long periods of time, especially kind of like at the movie theaters or after driving for long periods of time or sitting at their desks without getting up throughout the workday. So while one thing that can cause it can be some direct trauma, so kind of think a fall on a trail run, that's kind of a less common cause. It's more commonly caused by that muscle imbalance in the quadriceps, that muscle at the front of the thigh that can cause that patella or that kneecap to track improperly. Tightness or that poor flexibility in some of the IT band can also contribute to that patellar maltracking. Increasing the mileage too quickly can contribute to it, as well as excessive pronation, or when the foot kind of collapses a little bit too much when it is hitting the ground with running. And then, of course, weakness in the hips and the core can also be a contributing factor. So in terms of treatment, ice can help. Avoiding downhill running for the short term in order to allow things to decrease can decrease that strain on the patellofemoral joint, that kneecap. Working on strengthening those quad muscles and your hip muscles can help. When the hip muscles are weak, especially those hip muscles on the outside of your hips, what can happen is it can cause your knees to kind of dive in a little bit. So knees are kind of coming together, whether it's in a squatting form or whether it's when you're running. Pretty much running is kind of like a single leg motion. You're going from one foot to the other foot, and as that foot hits the ground, it's almost kind of like a mini squat on there. And if you don't have that strength of the double leg squat where where your knees are in good alignment, and if your knees were to cave in, when you switch over to single leg, it's going to become exacerbated a little bit more. So improving that muscle balance between those quads, those muscles at the front of the thigh, and those glutes, especially those outside hip muscles, can help. Sometimes using a brace or taping at the patella, that kneecap, can help to increase that alignment or improve that alignment, and can help with pain as well. So there's a variety of different braces that can be used and a variety of different tapes, from a Lucal tape or a McConnell tape, which is a little bit more of a more rigid tape, to a kinesio tape, which is kind of the colorful tape that you see on a lot of Olympic athletes. Increasing that cadence, or kind of increasing that foot hitting the ground and decreasing that stride length, kind of go hand in hand as to improving where your foot's hitting the ground. Similar to the shin splints, kind of decreasing that stride length a little bit decreases that braking mechanism that will cause some of that pain at the front of the knee. The iliotibial band, or IT band syndrome. The IT band is on the outside of your thigh. It starts up at the hip, kind of coming from your TFL, or your tensor fasciae lata muscle, and it runs down to just below your knee. And this band of fascia can cause a sharp or irritating pain along the outside of the knee. Typically, it gets progressively worse throughout the run, and it can often stop you from or cause you to stop running, and even cause pain with walking. Some people kind of try and minimize the amount of movement that the IT band has by kind of hiking at their hip or avoiding bending their knee as much, which kind of causes other gait mechanics and can increase pain both at the IT band but at other areas as well, and can contribute to some back pain sometimes. So it can be a structural cause, kind of just the mechanics of your legs if you're more bow-legged, but typically it's more tightness and weakness in the hip muscles that cause it, and overpronation, or causing your foot hitting the ground and your arch collapsing too much. Sometimes there can be that leg length difference that I kind of alluded to before, where it's typically not a structural leg length difference, although it could be, but it's more imbalance of the muscles that is causing that one leg to appear a little bit longer than the other. Sometimes it can also be caused by the surface in which you're running on. So running on a bank surface where one foot is a little bit higher than the other can increase that, as well as running downhill or doing excessive speed work. Rapidly increasing mileage can also cause it, as well as a crossover gait pattern. So where your feet almost cross over, so you're almost like your feet are going to be hitting the ground on a straight line down the middle, as opposed to your feet hitting the ground with one foot on either side of the line. Hamstring injuries. The hamstring is the big muscles at the back of your thigh. Typically, tightness and aching at the back of the thigh is what you're going to feel, and it can be kind of a couple different things. It can be either a strain or a more of a tendinitis in there, and that can cause you to alter your mechanics when you're running, and can cause some limping. With hamstring injuries, weakness from the hamstrings being either too tight or too flexible can be a contributing factor. Same thing, that muscle imbalance, that can be a problem with many things, but typically with this muscle imbalance, it's more the quads being stronger than the hamstrings, and the quads kind of overpowering that. Overstriding, or letting your foot hit the ground outside and in front of your knee. Doing too much speed work or sprinting can often cause a more of an acute injury. So if someone is doing a sprint down the track, and they stop running and kind of pull up and grab their hamstring, typically they're doing the injury that they have is a hamstring strain, or a tear if it's bad. Sometimes just taking an awkward step or twisting your hip and knee, whether it's on a trail run or a bank track or bank surface, that can cause a strain on the hamstring as well. Not warming up properly and trying to push too hard too quickly can also be a factor. In terms of what to do with regards to hamstring injuries, resting and icing, avoiding Doing intervals and hill repeats until the hamstring pain decreases can help. Doing more of runs at a kind of a slow, easy pace to avoid those quick starts and stops that interval training can do can decrease the pain. Using cross training, so using elliptical or bike, swimming to decrease that strain as well. Working on strengthening exercises in order to decrease the amount of weakness in the hamstrings and balancing out those stronger quads can help. And then same thing, Graston or ASIM can definitely be beneficial to helping that. Kind of with regards to any of these injuries too, as you're coming back from a chronic injury, you kind of want to figure out what the underlying cause is. And a lot of times that underlying cause is a muscle imbalance, and really making sure that incorporating strength training throughout can help out with preventing some of these injuries. So strength training, why would you want to do it? You can decrease the muscular imbalances, you can improve the muscle endurance, improve overall running efficiency, and decrease the injury. So with regards to marathon training, and that can be different from a sprint training, with marathon training, you want to have a lower resistance and a higher repetition. You want those muscles to be able to function over and over, mile after mile. Versus sprint training, sometimes you want a little bit higher resistance because you want more power in those muscles to be able to accelerate it on a quicker basis. But with marathon training, like I said, you want to be able to high repetitions because that foot's going to hit that ground plenty of times throughout a 1 mile run, let alone a 26-mile run. Ideally, you want to try and do strength training 2 to 3 times a week, and the focus is always on maintaining good form as opposed to kind of rushing through the repetitions. With regards as to when to do it, some people like to do strength training before a run, some people like to do it after. There's pros and cons for both. Doing a strength training workout before your run is going to be beneficial in the fact that those muscles are not fatigued. You're going to probably have an easier time with regards to maintaining appropriate form versus if you are doing it at the end of the run when you're more fatigued. If you're more fatigued before a run, however, though, it can make the run harder. So typically what I tell people to do is try and structure your strength training depending on your program. If you have a couple days off from running or on a cross-training day, it's going to be more beneficial because you're going to be less fatigued and you're going to be able to get more out of it. And in terms of how long the strength training, it does not have to be hours upon hours or anything. You can definitely do that, with regards to more of an off season. But when you're in the midst of marathon training, 15, 20 minutes can be extremely beneficial. And you don't need a lot of equipment. You don't need to, sign up for a health club, and you don't need all these specific machines or anything. You can do a lot with body weight or with just a resistance bands or a ball. So some of my kind of go-to and favorite exercises for strength training for runners are sideline clams, where you're laying on your side, your hips and your knees are bent, your feet are going to stay together, and you're going to kind of lift your leg up. Lateral band walk, so kind of walking from side to side with a resistance band around your ankles. And then what I like to do with that is, with that resistance band still around your ankle and making sure that your knees stay straight, doing kicks forward to the side and backwards. Working on single leg balance and making it as challenging as you need to, whether it's just on the floor and that's hard enough. Closing your eyes can make it harder. Standing on a pillow, using a mat or a Bosu ball can make it even more challenging. Doing planks where you're kind of in a push-up position and holding that, both kind of with your chest down towards the ground and then on your side. Doing some Russian twists where you're rotating your trunk from side to side to get more of your obliques in kind of a sit-up position. Doing heel raises, going up and down on your toes, and toe raises, going up and down on your heels to work those muscles at both the front and the back of the shin. Working on lunges, and important thing to do is to change up the position for those, doing them forward, backwards, or sideways, or matrix lunges. Working on squats, you can start with double leg squats, and then you can also do single leg squats as well to make it more challenging. deadlifts, so kind of leg straight lifting, whether it's a barbell, a kettlebell, or even just kind of going through the motion without any resistance, or stepping on a resistance band and using that. And then doing bridges, kind of laying on your back and lifting your hips up. So with any of these exercises, if you switch them to single leg, it's going to be more challenging. So when you're running, you're going from one leg to the other continually over and over. So you're working on a lot of single leg activity. So it's important to make sure that your body can adapt to those demands and be able to maintain its form when it's on one leg as well as when it's on two legs. Additionally, too, you want to make sure that you're strengthening the muscles on the outside of your hips and kind of in the lateral and the side-to-side direction and stepping backwards or posterior. So most of running is in a straightforward, and most of the time, we go out for a run, we're running forward the entire time. We might, do a little turn here or turn there, but that's not really engaging those outside muscles as much. So making sure that you're doing strengthening for those outside hip muscles and your glutes, and doing things side to side and backwards direction will kind of make you more well-rounded with regards to your strength. The other thing is important to do is to work on some stretching or using a foam roll. And it's important to make sure that you're warmed up before you do that. So if you jump out of bed and do a stretch, your muscles are going to be cold. Or if you've been, sitting at work all day, or, commuting, and then you jump out of the car and just go straight into your run, that's going to not allow you to be as efficient with your running form and can potentially cause injury. So you want to do some type of dynamic warm-up, whether it's walking or a light jog or doing some dynamic stretches, kind of like butt kicks or high knees when you're running, kind of a side shuffle. Those can all help to warm you up a little bit before you start your run. With regards to stretching, then if you do it after your run, the muscles are already warmed up, so you can do a little bit more of the stretching that is more of a static hold to increase that muscle length. So when you're warming up and doing some of those dynamic stretches and dynamic warm-ups, you're getting a little bit of flexibility there. But the true muscle strength, the true muscle stretching and flexibility gains are going to be a little bit more after, when you're holding those stretches for longer periods of time, for about 30 to 60 seconds. And you want to, when you're doing that, you want to hold that stretch, and you don't want to bounce back and forth into it to get the best gains. And you can do some self-myofascial release or massage and trigger point release using a foam roller to help decrease some of those tight spots, especially in the hips. It tends to work pretty well. Or you can use a stick or kind of like a rolling pin as well to help those areas. And in terms of how long, it kind of depends on how tight you are. I say it's about 1 to 5 minutes per muscle group, kind of depending on how you're feeling for the day and how much intensity that you want to put on. The other good thing that you can do is, obviously financially it's a little bit harder, depending on if you have access to getting regular massages, can kind of help decrease some of those nagging pains and kind of give yourself a little treat after putting in so many mileage. So big things for injury prevention, you want to listen to your body. You know your body, and that's number one thing. So you want to make sure that if you are feeling something, you listen to your body and you take action sooner rather than later. You want to make sure that you're following a training program. Well, it's great to wake up and say, I want to run 10 miles today. If you've only run 2 before, that might not be the best thing for you. So kind of that gradual build in the mileage, making sure that you're never increasing your speed or your mileage by more than 10% per week can help out. And definitely refer to Seth for a great training program, and making sure that, you're asking those questions, or let's say you do have an injury or a setback, communicating with him and seeing if things need to be tweaked a little bit with regards to getting back onto a program. Recognizing that rest days are okay and actually encouraged gives your body a chance to recover. So if you ran every single day, day in, day out, never really allowing your body to heal, a lot of times you can get an overtraining syndrome, or your body just kind of shuts down. You find that runs are getting harder instead of easier to do. Signs of that are experiencing that are signs of that overtraining, and kind of taking a couple extra rest days can actually make um, your running efficiency and your overall enjoyment of running a little bit better after you take that little bit of rest. Utilizing cross training, so elliptical, cycling, swimming, circuit training, to help increase your heart rate and your cardio without putting that impact and that pounding on your joints that running causes. For someone who's had a history of things like stress fractures or any of the overuse injuries that we talked about, that's something that I recommend is, doing some cross training in between and or utilizing cross training for some of your shorter runs to help minimize that impact. Make sure you get properly fitted running shoes. Utilizing local running stores are kind of your best bet for that. They know all the ins and outs of the new shoes that are out there and what is going to work best for your feet. A lot of those running stores will have treadmills or, have an area where they have you kind of walk and or run back and forth, and then kind of look at your feet and how they're hitting the ground, and kind of what your mechanics are before recommending a shoe. And that's kind of the way to go. And once you find a shoe that works for you, continue with that shoe, but do recognize that if you've always run in a certain shoe, that the manufacturers do change that shoe, even if it's the same model number. So making sure that you're kind of getting reassessed as those new shoes come out. Make sure you're doing your running homework, stretch and foam roll, do your strengthening exercises, putting in the not as fun work sometimes than it is going out there and running, but definitely essential in terms of injury prevention. Ice can help decrease some of that pain and inflammation, whether it's an ice massage, filling up a little paper cup with water and freezing it and then kind of ripping off the top and rubbing it on the area, or freezing a water bottle and works out well for things like plantar fasciitis and kind of rolling your foot over that, or a bag of ice, or some people do like a ice bath as well. And making sure that you are addressing injuries early on, taking a couple days off and allowing your body to heal as opposed to kind of pushing through can actually be more beneficial at times than, waiting until things get so bad that you're having pain with just walking. And things like a video gait analysis can sometimes help, seeing what your running form is and kind of slowing it down so that you can analyze how your foot is hitting the ground and where some of those muscle imbalances might be, can help kind of target strengthening and training a little bit more frequently. That's something I truly recommend for people who have chronic injuries that are not kind of healing on their own, or if you continually have things like stress fractures throughout multiple years, that you want to make sure that you're finding that underlying cause. So with regards to Athletico specifically, we offer a variety of different things. So we do offer free assessments at all of our locations, and what you can do is you can call one of the local clinics, or you can actually request an appointment online, and a physical therapist, occupational therapist, if it's more an upper extremity injury, or athletic trainer, will take a look at you, kind of determine some of the underlying causes and help facilitate, whether it's just giving you a few exercises to work on, help getting you into physical therapy or occupational therapy if needed, and or referring you out to a physician if it's something that needs a little bit more insight too. You can do physical therapy without a prescription from a physician. So if you have something that has been going on and you want to get in, make sure that you are reaching out, to the clinic directly that is close to you, or like I said, there's an appointment request online on our website. So I threw out a lot of information there and went through some stuff fast, but if anyone has any questions or comments, definitely let us know. And then I did put my contact information on there too.
Thanks so much, Karen. That was a lot of information and a lot of really impactful information. And as Karen mentioned, if anybody has any questions or comments, now would be the time to type those into your chat boxes, and we will do our best to get those answered. I have a couple scenarios that I thought of, Karen, that I would like to
Mhm.
hear a little bit more feedback from you that I've been getting early on here in training from some of our athletes. And one would be the scenario where you have an athlete that's training for a fall marathon who just got done running a spring marathon, like within the last month or so. Your thoughts on um, them jumping right back into marathon training after having just gotten done completing 26.2 miles, probably not fully recovered, and how that pertains to injury and how it might increase their chances of injury, and what you would recommend for maybe slowly working back into running. And then also, I guess, or one thing that I'm thinking about too is all the various injuries that you brought up. It seems like really like the hips and the glute area, um, in most, and not in some cases or in many cases, tend to be kind of the origin of injury or muscle imbalance. If you could expand a little bit more on that, I think that'd be helpful too.
Yeah. So with regards to the first scenario in which jumping back into marathon training after just completing a marathon. So that's kind of a hard one and it's very individual. So if I have to give you kind of my textbook answer, it'll be make sure that you're fully recovered, you take some time off, and um, then start progressing back into marathon training for marathon number two. With that being said, depending on what your base is overall, and if let's say you've been running multiple marathons a year, I think taking a couple of weeks where you decrease your mileage and then kind of jumping back in it can be fine. That being said, it's also if you're not having any injuries and you're going through completely fine. If you are having an injury, you need to take the time to kind of address that early on, even if it's completely shutting down running for a couple weeks to get your body to heal. Um, with regards to either scenario, you just ran a marathon, so your base is going to be a lot higher than someone who is, at the, kind of, I'll use a standard 6 mile kind of beginning of marathon, 18-week marathon training program, so you have time. You definitely have time with some of these to allow the injury to heal or to allow you to have a solid rest break, whether it's your body physically needs it, mentally you need it because you're sick of going out on, a couple hour runs every week. um, you have time to build that back up in there. And so that's when, reaching back out to a coach, physical therapist, with regards to kind of altering your program to tailor for what level you are at that time can be beneficial. Um, if anyone has specific scenario where they're going through that in Seth, if you want to, have them shoot me a message or if anyone specifically wants to, um, ask a question about themselves, I am more than happy to answer with regards to a certain specific scenario. And the second part with regards to hip and core, 100% hip and core is like key to preventing so many injuries, whether it's running injuries or whether it's, being able to walk up and down the stairs, preventing back pain, so many different things. And a lot of that is because typical day-to-day activities are in a straightforward plane of motion. You're walking forward majority of the time. You're not really getting in that side-to-side motion. So making sure that we're doing strengthening to target that, that's going to help. Like I said before, when you're doing running, you're going from single leg stance to single leg stance. So you're going from one leg and you're supporting your weight on there and you're switching to the other leg. When you're on one leg, those outside hip muscles and your glutes have to contract in order to hold your pelvis and your trunk level, so they're not dipping down and you're not kind of allowing that collapse at the hip and pelvis and at the knee. So working on the glute strengthening can definitely hold that in there. On top of that too is, when you have weakness in your core, you tend to kind of typically lean forward a little bit more. You try and lean back to kind of correct that imbalance, and that actually puts more strain on the other muscles and puts you at a less efficient running position. So hip and core strength is definitely key to preventing a lot of injuries.
Thanks, Karen. I think we have a question from Karen. Any reason why I sometimes have discomfort on the top of my right foot, sort of on the inside of my foot, right above my arch? I'm wondering if I ran with my shoe tied too tightly and just aggravated the tendons there.
Karen, I think you're pretty smart because that's the first thing I tell people to do is when they're having that top of the foot pain, especially if it kind of just came on, is the shoes might be tied too tight, or there's actually a couple different ways in which you can tie the shoes to kind of relieve a little pressure there. When you're running for long periods of time, sometimes you get a little extra friction there and that little compression at that spot. And sometimes altering the way you tie your laces. So whether it's skipping an eyelet as you're lacing or kind of lacing up and skipping, the crossover at that point can help out. So that would be the first thing that I would say. The second thing is sometimes when you have pinpoint pain on an area, especially if you're increasing mileage too quickly or doing a lot of speed work, sometimes it potentially could be a stress fracture, but I would say the biggest thing I would try and do is change the way in which you're tying your shoes, and feel free to reach out to me directly if you want me to kind of give you any more specific ideas or some pictures with regards to how to change the way in which you tie your laces.
Thanks for the question, Karen. If anybody has any other questions or comments, please feel free to type those into the chat box. All right, we've got another question from Allison. She asks, are there any post-pregnancy injuries I should be on the lookout for? My little guy is 3 months old now and haven't had issues, but what should I be looking for? Chicago will be my 11th marathon.
Well, first of all, Allison, congratulations on the new baby, and congratulations on going for marathon number 11. With regards to post-pregnancy injuries, the biggest thing would be I always make sure you're communicating with your OB that you get clearance to return to running. There's a lot of different things that can, be a factor when it comes to returning to run post-pregnancy because of pretty much the core. So obviously when you become pregnant, those abs kind of can spread out. One thing you want to kind of keep an eye on is diastasis recti, where those ab muscles actually kind of pull apart a little bit more. That's something that your OB probably would have told you already if that is something that you do have, but that's one thing to look out for. And with regards to that, I would definitely recommend seeing a physical therapist, specifically one who has experience in women's health, and they can tailor some core strengthening exercises that would avoid aggravating that. The other thing is, with regards to if you had natural delivery or if you had a C-section, that can put some different complications on ab strength as well, or some discomfort with returning back to running. Biggest things is, you just carried a baby for 9 months, and your body is not going to be the same, and kind of recognizing that. And even though you've done 10 marathons, making sure that you're respecting your return to running, whether you took time off during pregnancy with running or whether you continue to run throughout majority of the pregnancy. You want to make sure that you're kind of starting slow and really getting that gradual build up, so that you're not injuring yourself and you're giving your time to recover. Other things I tell new moms to look out for is when you are carrying your baby or carrying the car carrier or feeding, you want to make sure that you're switching sides and you're not doing everything on one side. A lot of times you can get some of that SI dysfunction or a little bit of leg length discrepancy with regards to muscle imbalance created by, let's say, always carrying your kid on your right hip or your left hip, or always carrying the car carrier on one side. So kind of being cognizant of making sure you're switching sides with regards to that. And like I said, if you do have questions, definitely reach out to one of your local physical therapists, especially one who specializes in women's health, and feel free to reach out directly if you need a little assistance with that. And make sure that you're talking with your OB in case there are any of those other complications or any restrictions that your OB would have on regards to your return to workout.
Well, that's really great information, especially for those newer mothers out there. And Allison, congratulations on the little guy. That's incredible. And the fact that you're back out there and putting the miles in and getting ready for your 11th marathon is inspiring. So congratulations. All right, guys. So I think as we kind of close things down here, I think one thing that Karen has mentioned, and I know this just from working with Karen for the past several years, is that if you have a question that maybe you didn't think of tonight, or you just didn't get your question submitted in time, Karen's contact information is on here, and I will send that out as well. She is more than happy to answer any questions that you have. Karen is part of the really the fitness community, and she's, like I said, an endurance athlete herself, and obviously an expert. And so she's here for you, and I'm here for you. But I selfishly love having Karen on every year because I learn a lot, and this is really great information. And Karen, can't thank you enough for joining us tonight. I know everyone here who was on the webinar and who will be joining and listening to the replay will get a lot out of this, or will have gotten a lot out of this call. But any last parting words before we jump off tonight's webinar?
No, just thank you for having me, and thank you all for listening. Like Seth said, and like I said, please do not hesitate to reach out if you do have any questions or need some direction. Is kind of the way to go. I am more than happy to help out. I love working with runners and kind of sharing that success. I wish you guys all the best of luck in your training, and let me know how it goes.
Thanks, Karen. And thanks again to everyone for joining tonight's webinar. Stay tuned. Our next webinar is scheduled for Tuesday, June 18th, and we'll be talking all things marathon nutrition with registered dietitian Tom Jordan. So again, thank you, everyone. Have a great night, and thanks again, Karen.
Thank you, guys.
Thank you.